listeners, welcome to the Women in Sports Therapy podcast from the Sports Therapy Association. We are your hosts.
I'm Fiona.
And I'm Debs.
We are so excited to share this month's episode in which we met with Dr. Claire Minshull to learn about her career path, her role models, navigating treatments and programming specifically with women's health in mind.
With decades of experience working across clinical, research and educational spaces, and a PhD to boot, we can't wait to share our discussion with Claire in this episode. This includes pivotal moments in Claire's career to date,
how the school of life has influenced her career path,
influential people from Claire's past and present who have been a positive influence or inspiration in her career,
Claire's best advice for those who work with clients and athletes experiencing women's health issues or conditions that are specific to their gender or identity.
And last but not least, goals Claire has set for the future and where can we find her next?
So without further ado, here's our chat with Claire Minshull. Please enjoy.
Okay, so thanks so much for joining us, Claire. Welcome to WIST. Can you tell us a little bit about yourself? Just introduce us to you and our audience, our listeners, and just explain a bit about you and what you do.
Well, thanks for the invitation. I'm delighted to join you. So my name's Claire. And I guess as a titleage, I'm a rehabilitation and conditioning specialist. What that broadly means is integrating knowledge of exercise science and adaptation into a rehabilitation setting. So I run a company called Get Back to Sport, which does exactly that in terms of education and training clinicians, therapists, how to construct exercise interventions, whether it be prehabilitation, rehabilitation, habilitation, whatever it is, to optimize the outcomes that you want to achieve with people or patients or athletes. And how I got here, so I did a degree in sports science, and I kind of did that because I didn't really know what I wanted to do. I was the first of my family to go to university. I just loved sport, as probably most people who's listening to this do and did. So I went to university, did sports science, and at the time I was really interested in exercise physiology, but there were maybe only, again, at the time, it shows how old I am, possibly only 2 jobs in the entire country dealing with to be an exercise physiologist. Wow. There's a little bit more kind of in the cardiac rehab side of things, but again, not vast. Okay. But then I was introduced to kinesiology as a topic area, my third year, and I was like, right, this is great. I love this. And the neuromuscular physiology, how the musculature works, and understanding some of these really important performance parameters. So not just strength, but how quickly we can develop strength and how quickly the musculature switches on. And then from then, I was offered an opportunity to go straight to PhD in a clinical setting where originally my PhD was designing through randomized controlled trials a 6-month rehab program for ACL. So this is way back in 2000. So it's a long time ago.
So quite leading the way, really. You gave an opportunity.
Oh, it was honestly, I had the best, inverted commas, clinical upbringing anybody could have asked for. So yeah, dealing with patients, integrating some of the kind of leading measurement techniques. I designed a technique to assess neuromuscular performance capacity by means of magnetic stimulation of peripheral nerves. So we're tapping into what a person is really capable of in terms of their physiologic capacity versus what they're able to do and elicit under normal conditions. Anyway, so I digress.
Tapping the brain as well, and yeah. So,
well, no, you take the brain out of it. It's at it's at the muscular level. You know, the machinery that somebody has. But
yeah, I was going to say, actually, I totally I did some of the research on neuromuscular. I used the interpolated twitch technique in my
yes,
PhD.
good stuff.
So
Yeah.
sorry, I just wiped my eye for the listeners. Like, I just wiped my eye, forgotten completely that I'm wearing mascara, and I'm wearing now that I smudged it in my face. But yes, I did some research using that equipment, and I found it absolutely fascinating. And I think we don't realize the limits of like the body, because you're just basically able to ramp up like electrical activity in the muscles without really involving the brain.
So I think I wrote a few papers and kind of termed it the emergency response, in so much as, is there a capacity there that we routinely cannot access under normal laboratory conditions, because you don't have that threat. You don't, it's all controlled. So even in perturbation studies, they know something's going to come, they know there's going to be a perturbation, there's some sort of expectation. But if you take a silly example of, let's say a woman's walking along the street with a kid, the kid runs out into the road, gets knocked down by a car, she runs out, lifts the car up with one hand and pulls the kid out with the another. Now, these are like extraordinary feats of human endeavor and capability, and it's not routine, and it is a bit of an extreme example, but you do hear of these almost unhuman or inhuman feats of performance. So there's something occurring that we're not tapping into routinely, but through the rehabilitation process and or prevention process, can we get closer to that physiologic ceiling under normal habituated or voluntary performance conditions? So you twitch interpolation is exactly that, in assessing, on top of a maximal voluntary contraction, how much extra force can you elicit if we just put some extra stimulus into the musculature. And then the key question is, can you access that?
Yeah, and literally, as you say, take the brain out of it.
Yeah, exactly.
Because you can't think about it. It's just got to be a do, rather than like, well, let's think I can do this. No, you've got to take that out. And how do you switch that off? How do you switch that off? Sorry, Fiona, I'm taking away your second question, so I've got sidetracked.
Oh wow, I think this is a whole episode anyway, isn't it? On like overriding your brain.
Capacity versus capability. Yeah, there's a whole kind of chapter of that in my thesis, and it's just so intriguing.
Totally.
I've digressed somewhat a little bit there, haven't I?
Well, we're still technically covering like you and I guess how you got to where you are, and
it's all good. It's all good.
And now we know like a bit of your background as well. So it sounds like academics has kind of been your founding stone of where you're at. So in terms of right now, you're working on kind of like on your own projects for the Get Back to Sport. So what kind of programs or what kind of educational materials is that sort of involving, or projects?
Yeah, so in the start of my career, I was very much interested in the elite athlete, and then now, and for the past, I'm going to say at least 5 years plus, my passion has led mainly with osteoarthritic populations, and those older adults as well, where some of the very, very simple things that we take for granted in sport, in elite performance, in uninjured populations in sports medicine, are just not transferred into routine rehabilitation programs, but yet can make dramatic kind of changes in rehab, in performance, in quality of life, in maybe even mortality risk as well. So I'm still research active. But I'm blessed to have been able to carve out a career where I'm not in academia anymore. But as I said, I'm still research active and maintain research links with hospitals and the like. But for Get Back to Sport, I provide education and training for healthcare professionals, clinicians, rehab practitioners, anybody who has got an interest and passion in dealing with individuals that, let's say, aren't necessarily at their elite. So they could be injured, they could be post-operative, maybe they're just older adults, and how to integrate some of these principles that fundamental to optimize the rehabilitation outcomes, through then to harnessing some of those really key scientific concepts that again can be integrated into rehabilitation that aren't routinely. So the building blocks of doing the very basics well, that's where you get probably 80% of your adaptation and the things that are most important. And then you can start to think about other things like the cross-education effect, blood flow restriction, non-concurrent interventions, and start to layer on these whole body vibration, these other techniques to enhance thereafter what you've done.
It is so
you've understood,
isn't it? There's so many crossovers and lapovers. It's just, there's so much going on. So you can find all of this sort of stuff on your website as well, can't you?
Absolutely, yeah. So and get back to sport.com. There's scores and scores and scores of blogs, and I think there's a link from your sites as well onto some of them, just about what that is. And what's really important for me is to simplify things, because when you deal with individuals who are in pain, who have an injury, we're not talking about this setting where everything's perfect and then we apply this formula and ta-da, you've got to do so. You've got so many things to be able to master to get initially their buy-in and their trust in you, that this is the right way forward, that then you've got to kind of think about the pathway of rehab. It's not that single interaction. And then what are they, understanding their performance demands and injury risks going, where you want to get them to, and then constructing a proper exercise. I say proper exercise program. What I mean is optimizing each and every input output opportunity to get the adaptations that you want. Then you go, right, okay, my knee bloody hurts when I do that. And you're like, okay, right. So what do I do? What do I do? I can't, if I deload them, then I'm using the strength stimulus. So that's not an option. And that's all, kind of all of these things integrated into the teachings that I do. So if for example, strength is something you want people to get better at, then by making something lighter, you've taken away that stimulus. You've shot yourself in the foot and your patient's foot. So what can you do to the exercise to adapt the exercise to maintain specificity? And there's lots and lots of techniques.
And have they bought in? Are they going to do their homework? Have you got through to their psyche? I know obviously we talked about earlier about brains and disconnecting that as well, but there's still that element as well, isn't there, that you're going to be working with?
The complex client, isn't it, really? And every client is kind of within their own right fairly complex. But I do think that also from an exercise prescription perspective, that maybe we can do better in terms of how we train our professionals to deal with different modalities. And I've noticed that within the sports therapy sphere, we have a tendency to lean towards in certain kind of like modules, at least, like the more strength and conditioning from a conventional like perspective of a competitive lifter. Like a lot of the students on programs tend to get dropped straight in the deep end and don't really get that basic overview of how to prescribe exercise and tailor it to an individual, which is quite daunting, I think, not just for the students going through those programs, but also thinking about the clients. We were talking about older adults. They're not going to need to utilize necessarily all of that kind of skill straight away or ever. It just depends on their function and their activities of daily living, what's going to be useful for them.
I would actually kind of possibly disagree a little bit with you there, in that in so much as I think, and forgive me, I don't think you were saying this, but I think it raises an important point. When we look at older adults, there is a tendency for us to make some assumptions that might not be quite correct with them. And yes, but also assume that because they're older, then their needs and demands are less. Now, absolutely, in terms of absolute demands. So what I do, I've got quite in terms of, let's put it in kilogram weightage in the gym, for example, that's going to be very different to somebody potentially, maybe not in their 80s, but relatively speaking, it might be exactly the same. And what's really important for those older adults as well is that we've got sarcopenic change that's associated with, age-related changes to muscle volume, mass, quantity, quality, and strength and force-producing capabilities that we need to work very hard to try and attenuate. And I think the first, we need to flip our thoughts on their head and look at the older adult as requiring more from our interventions and loading versus less than the average person that you might see who's in their 30s, for example, because we need to reinstate that or attenuate that decline, because it's not just that enables them to put a tin on the shelf. It means that their quality of life can be enhanced, their perception and experience of pain in an osteoarthritic knee is potentially less. And it's not just quality of life, it's quantity of life and all-cause mortality as well. So I do think it's because people are older, people have, and I'm saying people like generically, but there's a thought process, because people are getting older, they should be doing less, and we may kind of downgrade our thought processes and I'm trying to think of the right word here, but make some inappropriate assumptions about them, I think.
I know what you mean. Is it like sort of minimizing the potential to improve on like their,
because
muscle
they're old,
health and bone health?
They shouldn't be lifting heavy is a good example.
Yeah.
And my dad had a recent health scare.
That's societal. That's media. That's societal. That's how we think it should be. But I think there's an element, and forgive me if I'm wrong here, but there's an element, I think, Claire, that you're trying to push those boundaries and saying, hang on a minute, just because you're a little bit older doesn't mean you can't do this, or tap into people's specific wants and desires. Like I'm not 67 years old. But if I was 67 years old and I said, I'm 67 years old, I've always wanted to play golf, but I can't because I've got a dodgy knee. All right, well, let's work with that. Is that something you've always wanted to do? Let's work with that. Why can't you do it? Okay, there may be an option. Because I've got a prosthetic leg, and that's why I can't do it. Okay, fine. But let's have a look at your wants and desires. And I'm thinking that that's something that you tap into as well. Is that correct?
Absolutely. Who am I to say you can't do this? Yeah. I'm not. Yeah. I've got no authority onto what you can do and what you can't do. If there are some really pertinent clinical considerations that need to be taken into account, clearly you're going to do that. Fair That's enough. Absolutely important. Yep. But based on chronological age, we shouldn't make assumptions about people's wants, desires, and capabilities to change. That's fundamentally wrong, because they're people, and actually what we know about adaptation and how we get better at being stronger and more powerful, and what that means in terms of their quantity and quality of life, and prospectively as well, and the trajectory and where they're headed. It's almost unethical not to give them the same that would give an elite athlete.
You would question human rights, wouldn't you?
Clearly, as I said, their absolute performance is likely to be less in terms of speed, distance, mass, whatever it is. But relatively speaking, it might be exactly the same. It's still the same musculoskeletal system, albeit the tissue is a little bit older, or maybe the rate of adaptation is going to be different. But that is not in itself a reason to give them something that's substandard.
And it's very positive. I love your positivity through it. It sends out this wonderful positive message of you can do, and like you've got the sports, get back to sports and things like that. So it's you can do this. And that's a very positive mental change if everyone's told you that you can't do it, which is fantastic. I'm going to slightly divert, Claire. Sorry.
I just had something that I just wanted to add to that point, though, about what you were saying there, Debs, about positive messaging. So say maybe 10 years, 15 years ago, when I was starting my PhD, there was an absence really of focus on improving bone health from utilizing things like resistance training, And much of the focus was, I mean, the types of interventions that I was researching were very low load balance and strength exercises that
strength in inverted commas.
Yeah, like, I mean, with all the best intentions, but arguably, you know, weren't doing anything physiological enough to change bone health. I found that in my research. And therefore, you know, you're not really mitigating the risk of a fracture from a fall in an older adult group who are frail and prone to falling. And then changes even in muscle mass were quite, you know, dismissible almost. And the impact of that also on confidence and the individual, you know, their fear of falling at that age and in that kind of stage of life. We've come along a long way since then, I think, in terms of the availability of trainings. And just to go back to my point earlier, I think what I was trying to perhaps say, and maybe it didn't sort of come across well or clearly, was that the training available to sort of people going through the motions of qualifying and professional training isn't quite there. I feel like your training fills a gap for those who have maybe already qualified and kind of not, you know, like, I think that historically physiotherapists have had less of opportunities to maybe develop this area of work and like really, you know, hunker down and kind of get into the nitty-gritty and evidence-based practice. It's just not been that much evidence to support it, and it's really nice to see now that kind of coming through and being not just shared on, you know, training programs that are maybe degree programs, but also options to go back and CPD and like really understand what can be done to help the people and reflect on like where we've missed these opportunities. And I do think that, like, I mean, I love going into the gym and just seeing somebody over the age of 60 with a hex bar just kind of really, you know, bashing out a few deadlifts. And I'm trying to convince, I'd love to be able to convince some of my older members of my family to kind of go that way as they sort of reach their sort of mid-late 70s. But convincing people to do that can be quite difficult. And having examples of, you know, other peers, I guess, to encourage that kind of activity would be helpful. But, you know, that's kind of like still the same issue that I was feeling was trying to be addressed back maybe when I was doing my PhD, was this sort of like peer, I don't know what they called it, I can't remember, but like people who were of the same age group trying to encourage other people to fall into this kind of like way of thinking. Yeah, so like, you know, I don't know if that long rambling monologue has like resonated at all or made any sense, but yeah, I think that your point, Debs, was like right on. Like,
okay. Yeah, no, that's great. Fiona, I think that's really fascinating. The different types of views, that we're all kind of saying that it's good where we're at now and it can only progress. So again, that's really positive. So yeah, that's fantastic. Thank you. So Claire, just going on to some of the questions that we've got already sort of preloaded, if you like. One of them is about life and career. So the entwined life and career structure. I think what I'm trying to ask you really is, what's been the toughest challenge in your life so far that you've overcome, and how that you feel that you've learned from it?
Where should we start? So yeah, a couple really. So the PhD was one thing. In so much as I was kind of 2 years into this really exciting kind of journey, and then for various reasons I lost funding. So that the company, I was sponsored by a company that was set up, this is a longer story and we'll not go into it, but it was set up as a sports medicine injury prevention centre based in at the hospital, RJH Orthopaedic Hospital in Oswestry, and it was all kind of so forward thinking.
Yeah.
And I think probably that's why it failed, or one of the reasons why it failed. It's very difficult to sell prevention. Yeah, I got to see and treat and deal, from Olympic athletes, Premiership footballers. It was brilliant. But
wow, what is that like, training, that level of training at that young age? Really, it's
yeah. And as I was saying, had the best upbringing. Our contributions were as valid as the orthopedic surgeon, as the physiotherapist, as we had this brilliant multidisciplinary team. And that's one kind of really important thing that I've learned and held with me as I've gone through my career. That's what's possible. I thought that was normal.
Wow.
Yeah.
Okay.
So when I came out, I was like, actually, that's not normal. Why is that not normal? And then seeing exemplars of where it's really not normal, but even a little bit of that would transform care. Anyway, I digress. So 2 years into the PhD, I lost funding. So I was then faced with starting again.
And frustrating at that stage. Hang on a minute, I put 2 years into this. What's going on?
Frustrating ain't the word. It doesn't even come close. I know you'll know. Can you imagine if that happened? It was as I said, we're kind of talking a little bit off air. Do I do this and be bloody minded about it? Or do I train and become a landscape gardener? Because kind of like working with my hands and stuff. And like, so it was just the bloody mindedness really that got me through. And that was a really big challenge, because so much of my life had to change. And
to accommodate that,
earn more money to be able to do it. So I was full-time before, so I had to transition to part-time and take up a load more extra teaching. And still I was expected to kind of run a car, fun, all these kind of travel to Wales. I had to transition everything into, it was a really big undertaking.
Huge life change of something that's out of your control.
So that's something that was a really big challenge, but I'm glad I did it. And
we're glad you're doing it now, like the stuff you're doing now. So we're glad. So how did you overcome it? How did you go from that to where you are now?
So as I said, bloody mindedness. A lot of a PhD, again, if you only know, it's not just about how intellectual you are, because I don't really class myself as being all that clever. It's sticking with it and perseverance. And when the going gets tough, you have to keep going and keep going and keep going and find the resources. And it's tiring. It's, financially, you just on the bones of your ass, you're just like, but so I did that. And I was really fortunate as well that in the kind of last year, as I said, my parents have been very, very, very supportive of me, been really blessed. And for 6 months, I moved back home and wrote my PhD. And I cannot thank them enough for that, because anybody that's ever done that, has written a PhD, it's impossible, so difficult to write whilst you're jobbing and working. So you'll know. Where do you? No, so I did the PhD and then went off traveling for a year. Like, that's it.
It's funny. I think, like, if you were probably going to take a poll and ask PhD graduates what they did immediately after they finished their PhD, there's this sort of like big dichotomy of like going straight into postdoc or, other work even. And also, like, there's, I think, like you, I just needed to just go and be Fiona for a bit and
it's
do
the F it button.
Yeah, absolutely. And having supportive family around, not everybody's that fortunate. I was in a really lucky position too, where my family allowed me to come home and I worked and wrote my PhD. But yeah, you have like there are probably other life experiences that are just as grueling, but it does feel like with a PhD, it's a very specific type of grueling where you're pushed to your mental and actually physical, because you're physically away from your peers when you're writing up in another environment. I just found that so difficult, and having to travel to go and see 2 different supervisors in different parts of the country, and yeah, you do learn a lot about yourself, don't you?
Yeah, you do.
I think from your perspective, thanks for sharing all of that. And from your perspective, I think for our listeners and the audience out there, it's they're probably saying what I'm saying, like, wow, it's amazing. And it's a huge challenge that you undertook, and you went, nope, I'm sticking with it. And you could have done so much more, so something completely different, but you went, no, I'm sticking with this because I know it's what I want to do, and I know, and that's quite tough, I think, to know what you want to do when you're young and you've had training, but you think, oh well, yeah, well, I could do something else, and then to just knuckle down and go, and all the sacrifices as well. And I'm just wanting to know where you went traveling to. Where did you go?
I went around the world.
Did you?
Yeah, yeah.
5 countries you really loved. Sorry, Fiona, this isn't on the
5
question.
No, I'm
countries.
quite happy to hear that too, actually.
Okay.
So Canada. So I went kind of which way is it? West round rather than the way. I followed the weather. Kind of went in end of June, I think it was. America, Canada. So Canada. And I'd been before. Absolutely love Canada. Yeah, the people, and the scenery. Cook Islands, very nice.
Wow, not been there, lovely.
Fiji, I did my paddy and in Fiji on one of the islands. Just absolute bliss. Yeah. Where else? New Zealand. Loved New Zealand. Lovely. Interestingly, so I went traveling when I was 20, what would I be? 25, 26, after I'd finished straight away. Yeah. And I preferred Australia than New Zealand because there's a lot more going on. But as I've got older, I've been back more to New Zealand than Australia. So yeah, both brilliant countries. So those are some highlights for me. I ran out of money and time and started panicking of not being able to earn money and all that kind of stuff. So I missed out on I'm going to go to Cambodia and Laos and kind of missed that little bit off. But yeah.
Well, that's
Cambodia. I was going to say Cambodia was on my hit list when I was in Taiwan. I had the same issue. I was going to save up my money and travel everywhere. And I explored Taiwan like very thoroughly, but I only managed a couple of trips off the island, and I just like sunk my money on like, really going deep in one country. But yeah, there's so many great places,
isn't there?
Yeah. World out there. I'm not even going to start where I've been, but it was just interesting to know, after everything you've gone through, you've still kind of decanted your brain, and then you've just gone and expanded your brain in travel, which is just, I think it's very positive. I think it's very healthy. And it's a really good way forward, because you would gain experience as you travel as well. So you're still inputting the brain and you're still putting yourself forward, that then you'll help other people. And I think you gain understanding different cultures and stuff like that. So for me, I was really intrigued on that side of things, Claire. I'll pass it back over to Fiona to ask the other questions.
Reminiscing good times.
Good.
I just want to add though, I think that your, the breadth of kind of life experiences that it sounds like you've had from, the academics, the sport, the travel, it shows that, in order to be successful, or at least be, at the point that you're at, however you define that as success or contentedness or satisfaction from work, you don't have to just be in a very like linear kind of route through your career or professional life. And I think that it's important to take time to explore other areas of your life.
Totally.
I fundamentally agree with you, but I wouldn't have done when I was younger, because I had no exemplars of what the alternatives were, and how you could still get to the same place, but with a very different background and array of experiences, which again, with that kind of those blinkers on, I was on that academic conveyor and didn't kind of come off it. So I was very fortunate in what I've experienced, but it did give a very singular kind of view and viewpoint, and that everybody that you're socializing with, I won't say socializing with, but certainly conferences and you share information with, it's all very, very structured in that way. And academics are not very good at stepping outside of that box.
Yeah.
But it's ironic because the information and research that's been generated by them needs to come out of that box.
Yes.
So in order to have the applicability, which is why I love doing what I do, let me give you that information, because you en masse can change so much, rather than me just publishing it in a journal, as much as I like doing that still. Sharing it and giving the impact to others. And that's why I guess the research assessment exercises in academia, there is a big weighting on impact and applicability, and how has that body of research that you've generated, or your research group or your lab has generated, how has that impacted society in general? Has there been, some sort of change at a local level based on what you've done, or hopefully what we're doing with joint approach, hopefully will influence clinical practice? That would just be, astounding for us. But that's the important bit. But once in academia, having only ever been in academia, you don't know what's outside it.
So true.
It's difficult
Absolutely
to see
that. And I think
it's like being in an echo chamber.
Sorry, yeah. I think I haven't gone down that route as well. My route's completely different. So I'm kind of on the outside of the academia, although I'm, qualified. It's a very, life comes in. So I've come from an experience based, and I look at people with all these degrees and quals, and I'm like, when did you do all of that? Because I've been working. Like, how did that happen? So I think when I go to that situation, sometimes, and I was saying this to Fiona, sometimes I end up with imposter syndrome, because I'm thinking, I'm not good enough, I'm rubbish, and I'm sure there's listeners out there that are probably thinking the same sort of thing. Well, it doesn't matter for me. It doesn't matter. And sorry, Claire, if I'm kind of conflicting slightly, and perhaps I'm not. But I don't think it really matters where it's coming from, as long as it's the right message and you're getting the right information and you are actually benefiting and helping other people, is how I view things. It may not be how everyone does it. And I'm not saying we shouldn't dismiss one or the other, but I'm being lean on the academia, become the team if it's not your scope, or go the other way and go outside of it and claw in information from all routes to get to the main course is how I view things. And hopefully, Claire, that's kind of the sort of stages you're at too, and where you're at now. And I think you've taken a massive journey and recognize that journey, and I think it's incredible. I think you're incredible. Well done.
Thank you. I've had it's lovely of you to say. I've been kicked down the road a lot to do this, in and some very patient people with me. I've as I said, I am blessed by people that I know, and people have helped me along the way and kind of stuck with me, and I just knew there's a defining moment, right, where I was in academia. So I was at Nottingham-Trent University for about 9 years. I set up the sports medicine degree program, undergraduate to postgraduate, and PhD and the like. And I knew I wasn't quite, that's what exactly I wanted to be doing. I enjoyed my work, but as I was becoming more and more senior, I started to get more and more teaching and more admin, and more I like, okay, so that's kind of, but as I was bringing in more money and more research as well, it just kind of didn't add up. And then I'm like, do I want somebody very close to me, a prof, a friend of mine said, oh, you're right, you'd be prof in no time. And I went, like the brain, I don't want to be prof. I don't want to do that, actually. Like, right, okay, what do I want to do? Then that paps my pants, because how do I get out of this? Now, I've been, I'm so thankful for what I've experienced, and everybody's contribution to helping me, and all the people that I've met, and I wouldn't change anything for the world.
Absolutely.
But I could not see what is my, magnetic stimulation outside of, like, just because the view is so blinkered. So,
it's not you anymore. You've evolved.
I think it took a long while to understand and realize that, with a lot of help as well.
That boils down to the sort of gut instinct kind of thing, and like I totally relate to that. I had similar feelings of like, ugh. When I was in Taiwan, I was applying for lecturing positions, and every time I'd sit down to write a lecturing like an application, there was something like physically, like I found really hard in doing that. And there was obviously an underlying reason. That wasn't the time, that wasn't the job that I needed. And I think also over time, you know, your needs change, and having exposures, you know, travel, whatever, like you're talking about changing in your career path entirely, from going from an academic setting to pursuing your own, you know, design your own career effectively. It's a big commitment to make. To go self-employed is, I don't think that you realize until you do it how bloody terrifying it is to be reliant on yourself and no one else. It's thrilling, but it's also, you know, you've got to show up every day, and you're the only one accountable for that. And if it works, it's down to you, and if it doesn't, it's down to you. I think for me, like I've done a mixture, and I think, like, well, I mean, I suppose we've got quite a few questions lined up where we can kind of talk about like what you see for yourself in your kind of future. I feel like, well, I suppose I should look at this list and ask another question now. So I'm going to dive in, but I realise we've covered so many things. We've probably answered all these questions now, but and you, I suppose, touching on like what you've talked about, you mentioned a professor kind of like who suggested professorship. But are there any people who you've encountered in your past who stand out as being a positive influence or inspirational in your career, aside maybe from your family, who you've talked about a little bit?
When I started my PhD, as I said, I was blessed to be in this, you know, brilliant environment where multidisciplinary team was the absolute norm. And leading that team was an orthopedic surgeon called Mr. Di Reese, and who's since retired, but prolific in what he did. He did the first ACI surgery in the UK, and was up there with the guys that kind of doing the cell biology and pioneering these operations. And it would be, you know, be in clinic with him, and you'd see all these amazing athletes, and then an entourage of just flown in from Pakistan with, you know, they own these banks in Pakistan. Comes, you know, he was just so prolific, but he was utterly humble. And you know, as I said, we'd be in clinic with him, and he would turn around and ask us. So there was myself in the capacity as a sports scientist there, and another PhD student, a friend of mine, a physiotherapist, him, and then he'll have some regs in the other clinics, other rooms, and he'd say, "Well, what do you think?" And I remember the first time he asked me, I shat myself. What do you mean? What do I think?
Yeah.
So what you should be doing from a rehab, right? Okay. Yep. Okay. Good.
Oh wow.
I'm like, and he was actually asking opinion and valuing that opinion, and he was like that with, you know, he surrounded himself with brilliant people. Not necessarily I was brilliant, but he surrounded himself with people of whom he respected, and that they were there for a reason, to help patients, not to make himself look good.
Yeah.
And that is, you know, it's utterly humble. And his way of being with patients is, you can deliver exactly the same information to a patient in, let's say, 2 different ways. And the way in which you deliver it can mean whether or not they get better or they're able to go back to sports, or not. You set the rehab trajectory. Yeah. And he was just amazing at doing that. Oh, no, you'll be fine. You'll be fine. Oh, we'll get this sorted. Don't worry about that. Rather than, yeah, you've got, I don't know, take cartilage. Yeah, there's a massive articular defect or defect in your articular cartilage. It's this size. What we're going to do is we'll have to kind of do a 2-phase operation. We'll cut down here and we'll you know,
panicking.
You know, that information still being delivered, but you know, we're very much, you're here for a reason. And he had a perfect way of being with. He was doing motivational interviewing effectively.
Wow. Amazing.
So that he has been instrumental in my career.
Sounds like a complete legend. Sounds like an example of exactly where we need to be aiming for, and like shows the power of words, really. I think like Matt Phillips over on the STA podcast have probably heard it a million times from him, but you know, words matter, and you just can't overstate it, really, how that influences people's trajectory in their recovery from injury.
Yeah, fundamentally.
He really did influence you and inspire you.
Yeah, and I'll never forget that, and we're good friends, and you know, hope to I hope he lives a long and happy retirement, very well deserved. But yeah, he's something as well about him that he trained lots and lots of registrars now, orthopedic surgeons, and there's a thing, right? So if you've known him, there's like a, oh right, okay, so you've trained it. There's an unstated thing that you know that person is going to be great. If they've been trained by Di, or they've had anything to do with him, you're just like, okay, you're in good hands here. So I don't know. It's just as I said, I'm blessed.
Oh, you really are, and thank you so much for sharing it with us. It's just incredible.
I'll have to make a note of that name and like make sure I remember when I cross paths with the offspring of him.
Yeah, definitely inspiring for sure. So there is another question that we do have, Claire, and I know that it's quite a vast. I know we've discussed this off air. Basically, it's quite a vast question. I'm just going to read it out as to how we put it together, and I think there's all sorts of alternative ways that we can go on this. So when we bring it out to the audience, you guys, your listeners, may understand kind of where we're coming from. So I'm just going to throw it out to you, Claire, and then we'll take it from there. Is that all right?
Mm-hmm.
Okay. So asking you if you had any advice for our audience who may work with clients and athletes experiencing issues and conditions that are specific to their gender or identity, what would it be?
You know?
That's the best.
So honestly, when I read that, because you obviously sent me these questions in advance, I wanted to know what you meant by that, because
that's right.
It is
huge,
totally vast topic. So there's many ways you can go with this, and I don't know if I'm able to add anything of value in that, but you know, are you talking about ultimately it comes down to the individual, right? So are you talking about that person in front of you, and you're interacting with somebody in front of you, and if it's related to them as their biological sex, their identity, their any things that might come with that. So if they're female, biologically female, and they're, you know, menstruating or not menstruating, or, you know, it's this, you've got gender identity. There's like, it's an impossible question to answer, I think, in a short period of time.
And yet you still are. So you're amazing, because you still are.
So
answering.
I think from where I'd come from, I guess, in that, if we were able to glean anything of value, and I've learned from colleagues as well. So I'm not an expert in this area. Some of my initial studies were, and then probably inappropriately titled now, but sex-linked differences to the person in front of you is the person that you need to deal with and treat, and they are everybody's an individual. Okay, so if we're thinking about biologic sex, and whether or not we should, based on somebody's biological sex, automatically adopt a different treatment pathway or exercise intervention because they are biologically male or biologically female, we don't have enough scientific evidence yet to make that call. So because somebody is female doesn't mean that you should give them a different strength training program, a different rehabilitation program, because they're female, versus it should be different compared to what you give males.
It's what they can do as an individual.
Now there might be differential responses based on sex, but what's really important to know is that females are different from each other. So you have females who are on a contraceptive pill, females who are not on a contraceptive pill, females who are perimenopausal and menopausal, and even within those subcategories, females are different from one another. So I think it's really reductionist to, and I'm not suggesting that you were doing this, but the approach to treat individuals differently purely on the basis of let's say whether they menstruate or not, or should menstruate or not, because then you've got amenorrhea and the red S and etc. So we can't do that. But there might be a differential response to exercise intervention and or training based on where somebody is potentially in the menstrual cycle, possibly. So on my site, there's a free masterclass, mini masterclass from Professor Kirsty Elliott-Sale, a good friend of mine, whose area of expertise absolutely is with the female athlete and the female, I pushed her on the female patient actually.
And just remind us of your website again.
So that's getbacktosport.com. Or getbacktosports.com. So, and that pronounced
alliteration.
Yeah. And a lot of her research is showing that, you know, on balance, let's not treat females completely differently to males, but let's treat females as individuals. So as we were saying before, if you've got, you know, if you're a woman and you've been through, you know, you're going through the menstrual cycle, some days you just feel like shit. And there isn't any way on God's earth that you're going to be able to put in a high intensity training session. I suffered terribly with crippling stomach cramps, and people, just go and exercise. Poke that. Going for exercise would make me crease over. It would make it worse. And I once went out on a run 2 miles in. I was crawl in a forest, like in a fetal position, because I could not move. It was so bad. So everybody's different. So I think that's, you know, if there's one thing to say is look at that person in front of you and understand what they're telling you, how they respond individually, and have that individual approach. Now, then you can start to layer on, you know, have you got time and the resources to be able to, you know, if you're thinking about the menstrual cycle, where people feel, she feels good or not so good in the cycle. We know influences of female physiology has differences and tissue compliance. We know potentially that, I don't know, let's say take a female athlete, they might have a slightly smaller notch size in the femoral condyle compared to male, which may be a risk factor for ACL injury if we're looking 10 years ago. But can we do anything about that? No, we can't. So, you know, be pragmatic, I think, and from an individual perspective is probably the point where you go there from. And then, are they postmenopausal? Are they perimenopausal? Has that got any bearing on what you're going to do? You know, is it just about how they feel? And if they, you know, they know themselves, their body better than you do, and how they what their lived experience is. So, you know, listen to them and help. If you feel like that's got some bearing on what you're going to do with them, then absolutely listen to them. But just on the basis of biologic sex, there's, you know, don't assume that there needs to be a differential approach.
I think that's an incredible answer to a very vast question, Claire. I think you nailed it. Well done. Going, sorry, Fiona, just going on to some of the stuff that we've talked about before. So perimenopause is one of the podcasts that we've done versus menopause. And also we all kind of know, so some of the listeners may know, obviously, my struggle with endometriosis and women that I help with endometriosis as well. So towards the menstrual cycle. For example, can only go from my own experience, Claire, where I have at the moment, I have a fibroid and I also have a cyst on one ovary. I have severe adhesions within my pelvic cavity, so it's very difficult for me to turn and twist and things like that. So it's not just musculoskeletal that's happening. There's other stuff that's in there that can then impact as well. So I think you're absolutely right to answer such a vast question, and the way you've just done it, you've absolutely nailed it, as I said.
Skirted around the issue. But
on the politics of it.
on the masterclass, there's I think Kirsty's put some of her contact details on there. But what I would do is if you've got an interest in this area, she's definitely a very, very good place to start. So we think, talking about postpartum, talking about whether people are on the contraceptive pill or not, kind of menopause, menstrual cycle, red S, energy deficiency, all these kind of things. This is absolutely her bag. So yeah, she's a very good place to start if you want to read more into that.
We'll have to put a link on our episode description so that the listeners can follow that.
Sure, with a link to the podcast.
Yeah, definitely. And I think just gleaning from what you're saying, that individualized approach is really the theme throughout this, really, that the person in front of you is the person that matters. And especially, I think, like we kind of touched upon the sort of absence of really having any evidence anyway that's meaningful or substantial to base differentiating between genders. But like you say, it's, I think, sort of redundant.
It's coming out. There's a lot of, thankfully now we're doing, we as a not me per se, but the academic community is a lot more focused now on looking at female specific responses, or even within different phases of menstrual cycle, exploring some of these unanswered questions. And I think, so Stacey Sims obviously is another big name to follow, and she's kind of talks a lot about this as well. And the evidence is emerging that maybe we should have a slightly different approach potentially, but on balance, there's not, we haven't got that volume yet. And also, what would be the detriment to not having a differential approach? And I don't think that there is one, unless as long as you're acknowledging that individual in front of you. It might be discernible potentially at those very higher levels of performance capacity and capability, and where performance is measured in importance. So at the elite end of that spectrum, or the higher intensity trainings that are measured and the like. So I'm not saying the evidence is completely absent. It's just not there yet for us to make those decisions. So yeah.
Yeah, fantastic. Thank you. Appreciate that. Over to you, Fiona.
Yeah, I think we've got one last question, which kind of ties in with where we're at with the sort of discussing your career and like what you're doing and where you're headed. So have you set any goals for the future? Like, where do you see your kind of career, if you can? Do you see any particular direction that you want to go in with your work, and where can we find you next?
Not landscape gardening.
Oh,
yes. God, yeah, you should see my garden. It is
right.
yeah.
No, I didn't.
So busy right now. Okay, so short-term goals. I'm finishing my second online course. So the first online course for Get Back to Sport, the flagship one, if you like, is Strength and Conditioning for Therapists. That's following up now with a similar length of program, all about, so that's building strength. And then the next one is how do we express it? So looking at power, rate of force development, a bit on hypertrophy, and maybe a bit on exercise muscle damage as well. So learning more of that neurophysiology, but importantly, how do you adapt your training? How do you adapt your rehab to be able to respond quickly? Injuries happen very, very quickly. So just to be strong is not going to be sufficient. We need to be able to produce force quickly. So a whole load of stuff on that. So that needs to get done in the next month or so. So I've almost finished writing it. So yeah, that's coming up imminently. So check the website. The longer term goals, to be so arrogant, I guess, I would love to make some small change to the way in which we manage osteoarthritis, and maybe porosis, but osteoarthritis, particularly, my passion's in with the knee, but obviously the principles relate to the hip. And it boils down to what we were saying right at the beginning in when we're talking about older adults. If we can better the conditioning of that muscular system and musculoskeletal system by doing some very, very simple things, but effectively, I think that's going to make a tremendous impact. So we've set up a company called Joint Approach, which is, so if you wanted to check the website, it's jointapproach.co.uk, and that's a multidisciplinary program which involves the psychology front and foremost, although it's called mindset for patients, because if you haven't got the buy-in from patients, then it doesn't matter what you do thereafter. And education around what osteoarthritis is and what it isn't, all positively phrased. So what I was saying to you before about my mentor, if you like, how he phrased things was very, very positively framed. So whilst it's normal changes in the joint, and this is what it is, patient want information, and we don't want to patronize them, but let's make it feel like actually we're empowering them with information. And importantly, there are changes that you can make. So because that joint surface has got these age-related changes to them, doesn't necessarily mean, we don't want to say, well, you're never going to rebuild that. And they think, oh, shit, that's me done now. What's the point? It's normal age-related changes, but we know that pain and function is a combination of many different things which we can change and manipulate, starting with how you think about things, but also the strength-focused exercise intervention is what we're prescribing. So we're working with an NHS group in Wales at the minute. We've got many conversations around the country as well. So we're looking for more collaborations, but effectively properly dosed exercise to elicit strength adaptation. That's working the muscles bloody hard, but for a few repetitions. And might I add, it's all online. So there's a lot of skepticism where you could get 60, 70, 80 plus year olds on Zoom and online, but
can you?
More for you for being so yes, we can. It's not an issue at all. Yeah. It's brilliant, honestly. Watching, so we do a combination of and people selecting whether they want to watch the exercise videos and do them themselves at home or join live exercise classes online on Zoom. And watching those classes is seriously better than Netflix. It's brilliant. Seeing these people work so hard, but also they're giving each other internet advice and where they can get grants from, and it's just brilliant. And I think it's what you were saying before about like the community aspect, where I think you were saying, Fiona, about looking at other people for inspiration and help, and they G each other on, and the people that come to the classes love that community feel, which is why we designed it, and we're delighted that it's working well. So seeing fantastic results in terms of reduction of pain, improvement in function, but some of the really heartwarming things to hear are that people's lives are changing. That's and brilliant. People going on holiday, people are able to walk up the stairs when they couldn't do that before, which means that then they now are going shopping. Their lives have opened up, and that's for me what it's all about. So longer term goals, I want to give this to as many people as possible. And with a fantastic team that we've got, just I don't know, this help people improve their lives, and let's not withhold stuff. Let's do the very best for them that we can. So
that's worth your whole journey. Thank you, Claire. That's absolutely worth the whole journey that you've shared with us today, and your trials and tribulations and struggles, and the people that have inspired you along the way. And every chance you get to say it, you tell us that you're blessed, and then you're ready to bless others, and that's really commendable. And yeah, well done you, absolutely.
Very kind of you to say, thank you.
Yeah, I reiterate, I have the same sentiment, and I think it's really nice to actually get to know Claire Minshull in a maybe a bit more like of a professional career life path sort of. It makes it easier to understand how people go through their get to where they are, and I think it can be a bit lonely pursuing this kind of career path, especially if you're self-employed, and we don't work always as part of integral teams. It's usually connections with various groups of people, so it's just really nice to be able to hear your story and share that with our listeners. And if I guess on that note, if anybody else kind of wants to follow up and communicate with Claire, Claire, could you tell us a little bit about like how to do that?
Send a pigeon. My granddad used to raise pigeons. Anyway, so Twitter, that's bird linked, isn't it? Yeah.
Well done.
Like seamless, wasn't it?
That was excellent.
You're not getting my job. Get lost.
Yeah, so my Twitter handle @Claire_Minshull. So I'm active on Twitter, on Instagram @GetBackToSport, and then on Facebook, Claire Minshull again, and Get Back to Sport, and the LinkedIn platform as well. So if you go to my website, getbacktosport.com, there's an email address there as well. So if you wanted to reach out, do. I mean, delighted to hear from STO members and listeners. Always a pleasure.
Oh, that's fantastic. Thank you so much. And I think in conclusion, just what an incredible journey that you've gone on. Thank you so much for sharing it with us today. Thank you for answering all of the questions, no matter how vast they became, and nailing it. It's fantastic. And just being inspiring yourself. You may not feel it yourself. I know you are quite humble in your outlook, and I think that's taken from inspiration from others as well. But I think that from your perspective, you just want to physically and mentally help others wherever you can, because people have done that for you, and that's an incredible ethic that's coming across from you. And I think it's also something that our listeners will be very happy to hear, because I think it's also we care as therapists ourselves, so it's really good to hear it. Thank you so much.
Oh, it's absolutely my pleasure, and thanks for inviting me on. It's been a joy.
Yay. Good. Perfect. Right then, on that note, I think we'll wrap up our podcast episode there. So catch you guys on the next episode, and thank you for joining us.
Bye.